InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, your host for today, and our guest is Dr. Richard Bisceglie. Welcome, Dr. Bisceglie.
Thank you. Thanks for having me, Jay. I appreciate it.
What do your patients call you?
They call me Dr. Rick.
Is it okay to call you Dr. Rick?
Sure, absolutely.
All right. Dr. Rick is licensed to practice Naprapathic medicine in the state of Illinois. He is certified nutritional specialist and infrared light and laser therapist. And I assume that's what we have here?
Yes. Yeah, we have both of those devices here today, so we can do a little demo later if you'd like.
Excellent, excellent. And Dr. Rick is currently on staff at the Center for Holistic Medicine in Riverwoods, Illinois, and is co-founder of the Imagine Holistic Health. Now, this Center for Holistic Medicine, you said it's also kind of like on the border of Riverwoods, Deerfield?
Yeah, Riverwoods and Deerfield, yeah, on Saunders Road. It's a small outbuilding next to near Saunders Road.
Now, you call your place Imagine Holistic Health. Mm-hmm. Any particular reason why you use that word imagine?
Well, imagine kind of brings about, endless possibilities, And holistic health, of course, is the whole mind-body connection that we use when we treat people for various conditions. So it really fit nicely. Plus, I like the song "Imagine" by John Lennon, so yeah, it kind of fit in there nicely.
And it's also you're telling prospective clients just to imagine holistic health.
Exactly. It plants the seed right away.
And so, why is it important to think in terms of holistic, mind, body, spirit?
Mm-hmm. Very important. I think we're too focused here sometimes upon treating symptomatic treatment for just about any condition, and that's good at times. But I think there's more to it, more to illness and wellness than there is just by symptomatic treatment of people for various conditions. I mean, there's an emotional connection, there's a spiritual connection. Everything that is imbalanced in our lives can express in our bodies as different various conditions or pathologies. So.
And I would also think that when you imagine holistic health, it's prevention.
Exactly. The emphasis is on wellness versus, say, just symptom treatment or disease treatment. Our emphasis then shifts to more of a wellness type of a preventative.
Okay. Now, what is napropathy?
Okay, napropathy is about maybe the early 1900s when it was started originally, and the doctor who started it was a chiropractor. So it's an offshoot of chiropractic, I suppose, but a lot of the manual medicines started about the same time in history. Their difference was, the fundamental difference was the origin of the pathology. So napropathy is a physical medicine techniques. Chiropractic is too. Chiropractic, in general, everyone's different, but for comparison purposes, chiropractic adjustments, more high velocity, cracking sort of thing that you'd associate with chiropractic adjustment. And napropathy, and their theory is that the origin of dysfunction is in the subluxation or the issue with the bone or the disc. Napropathy focuses on soft tissue adjustments, releasing that, so that then the body can then self-correct with any kind of issues with the skeletal structure.
And so it's like hands-on healing?
Yes, okay. Manual.
And how would you say napropathy is different, say, from massage therapy?
Mm-hmm. That's a good question, because a lot of the manual techniques are similar in a lot of the fields when we talk about soft tissue adjustment. But I think the main thing, if I was to point to a few, would be one, you're really kind of trained as a doctor to look at what else it can be, not just the pain right here, but could it be a cancer, or could it be referred pain from something else? A little more in-depth type of analysis or evaluation goes on before you even touch the patient, because you want to make things worse.
And when you say some analysis and evaluation goes on before you touch the patient,
Yeah.
what kind of analysis and what kind of evaluation is occurring even before you touch a patient?
Yeah. The first thing I do is really sit down with the patient for however long it takes initially to sort of get to know them. And as you talk to them, you get a sense of, well, is there other things going on? What else might be happening in their lives that needs to address to help correct the problem that's going on? And you start to connect the pieces initially there. And then there's orthopedic neurological testing, what then kind of focuses in on really where it's manifesting in the body, and that dictates treatment.
And what kind of orthopedic testing do you do?
Well, you do a lot of the classic orthopedic testing, the compression of the head if there's an injury in the neck, if it elicits pain, pressure kicking out on the leg, if it elicits pain. It's all about trying to see where the issue is just by the specifically designed orthopedic test.
Okay. And does napropathy, you talked about like its origin, how it's offshoot of chiropractic. Does it mean something in particular?
Yeah, it does. It means to fix or correct suffering is really one of the translations. It's Czech. Most of it's a Czech or an origin, Czechoslovakian or an origin. The other part is something else which escapes me, but really the idea is to fix or correct suffering.
Now, and how many years of schooling did you go? You have a bachelor's degree, I assume?
It's a postgraduate 4-year program, and part of that's a year internship where you're really operating, seeing patients clinically. There's clinical review sessions, so you learn from that whole process, just like any other type of clinical practice or clinical part of education would be. So you do that for about a year. And so you're really kind of developing your style, you're developing how you practice and developing how you approach patients.
Yeah, I had a friend who went through Naprapathic school, and I think they actually dissected bodies at Rush Hospital.
Yes, we did.
With medical school students,
Yes,
I might add.
yeah, we did that. We had a year at Rush Medical School alongside surgeons and medical students, and we would do the same thing that they did, because it's essential in any kind of manual medicine that you know exactly what's going on, where everything is, too, in the body, and then you get to see how things are connected. And so surgeons would go in and they would practice on patients prior to maybe a difficult surgery. So you got to participate in that and just kind of observe. And so it was a really rich part of the education.
Well, my point is that napropaths are very well educated, very well trained.
Yeah, in connective tissue disorders, yeah.
And so how is napropathy similar and different than other forms of physical medicine, such as chiropractic?
Well, the first thing I mentioned was it's a little different than in terms of high velocity technique versus soft tissue correction, which is really gentle, very specific, and a very, very easily tolerated treatment. So some people don't like the hard adjustments, some do, but that's just one difference. The sessions are longer, so because you're doing things more purposefully and more slowly, it takes longer to really achieve that.
How long of a session would you say?
Typically for about 45 minutes to an hour. So, and part of that, of course, is talking. Part of that's, it could be modality treatments like the laser, the infrared. There's other things that are incorporated, and it's not just all manual, but there are other things that I use personally, as well as nutrition, to help, in that session.
Now, let's say you make a soft tissue adjustment, which helps align the disc, etc., or joint. How long can a patient expect that treatment or alignment to hold?
Typically, I like to see patients once a week unless there's really a problem. So we decide how that's working together. So I'm not just dictating how long it goes, and everyone's different. Some people might come in twice a week. But the real key in any kind of physical medicine is really what they do outside of the office. So I say, well, if you do your homework, and you do your stretches, and you do your exercises, and you do your nutrition, and anything else, maybe some modifications in your lifestyle, that's going to really determine on how the course of your treatment goes and how fast or short it's going to be.
Do you send your patients home with treatment plan and exercises?
Absolutely, yes, yes. And correction is that once we've identified them, what they can do to help really empower them with the knowledge, and then, of course, the actually performing these activities to then regain their own health instead of just be helpless and at the mercy of coming in, laying on the table every week.
Now, before the show, you mentioned an interesting case with a very young child. You want to tell our audience about that case and how you can help young children?
Young children sometimes are pretty difficult because they haven't learned to express a lot of things, especially if they're infants, but certainly little kids too have issues with younger children with really saying what's wrong, and oftentimes the parent is in the room, so it's sometimes a function of the relationship between the parent and the child and how the child feels. But in this particular case that you mentioned, a newborn, I don't know, maybe a few weeks old, crying. Upon examination, I noticed that the parts of plates in the skull were a little bit off. Now, when a child is first born, baby's first born, that moves a lot to get through the birth canal. So you still have some of that flexibility left after the child is born. So an adjustment of just identifying it, lifting it up gently, moving it over, you hear a nice click, and the child stops.
You literally heard it click in place?
You can hear it click in place. It does move at that age, and even in adults, it moves about maybe 1/100th of an inch or so. It's very slight, but you can manipulate the cranium. There's some dispute about whether or not the sutures are movable, but the reality is that they are still a little bit movable, and so even with adults, you can still move those around.
Okay. So what types of conditions or illnesses do you treat?
Okay, a lot of things. It varies all over the place. Of course, your usual physical manifestation of, say, carpal tunnel syndrome, your back pain issues.
In carpal tunnel, are you seeing it more? How long have you been in practice?
About 10 years.
And are you seeing carpal tunnel more now because of the computers, keyboards, and smartphones, or the people with their thumbs?
Everybody has what I call computer or phone arm, where the mouse or the texting or the position of the arm creates a lot of other issues with the muscles and the shoulders and headaches, so it kind of goes all the way up the chain. So it's a malady of modern times and how we live our lives. It's a very common problem.
And is there any way to prevent that?
Yes, ergonomics is a big deal. How you're oriented towards your computer or your workstation, so you're not, with laptops and phones, you can be all over the place, and it's important to be, if you're going to be doing something for a length of time, to be doing it in a position where, you're not straining any other part of the body to kind of exasperate or make it,
Well, I would think that a lot of people stay in stressful positions because they're not aware of it. They're focused on what they're seeing or typing instead of their own body.
That's true. So the awareness is a big part of that. So I provide them with a list of computer stretches to use if you're using a computer. Do these every 20 minutes or half hour.
Is there something
whatever.
that you could show our audience in the chair here?
Mostly it's going to be like, you want to move the arm back behind here and stretch out the arm back behind your body so you get your shoulder kind of rounded backwards. Because typically with computer use, we're all like this. We're all hunched over. And also.
So it's doing the opposite.
So you want to go in the opposite way. Specific areas that have problems with the computer arm that we talked about, this always hurts. This muscle that goes across right here, it's involved, say, in rotation. You can feel it move when you do this, is to rub that out too. So that's another one. So stretches like that. So for carpal tunnel syndrome, it's hard to demonstrate, but you get on a flat surface and you lean on your hands and it opens up the tunnel, and here where the nerve is, that gets irritated because things are so compressed. So the mouse, I'm exaggerating, but you get the lobster claw motion that really irritates them.
And what about chairs? Are all chairs the same, or some chairs better than the other? I know I've seen some articles on ergonomics where you want to raise and lower the proper height, et cetera. Or even at my computer, I sit on one of those balls. I don't know if you recommend them. I'd be interested in your opinion.
Yeah, they're good. I mean, if you're just using the ball.
I just sit on the ball and.
A lot of people do that at work, because it doesn't. forces you to kind of sit up straight, and it keeps you in a certain posture it's really advantageous when you're using a computer all day. You can move around. There's some motion there.
I'm glad you said that.
Yeah, so that's a good thing. Yeah, the chairs vary. You don't want to sit on, say, a folding chair because it's too hard, and you want something a little softer. A good lumbar support in the chair, like in a vehicle, would help because you're in that position. You want to keep your lumbar vertebrae and with a little bit of a forward round as you sit in the chair too as well.
Lumbar lower spine?
Mm-hmm. Yeah,
Okay.
lumbar lower spine. A lot of supportive devices or pillows that you could get for that in your chair too, if there's not one already built in. Some people need a little more support than others. And also, again, awareness is a big factor. So you want to keep the shoulders back. You want to keep those angles, the angles like this with your feet and your arms and your hands as best as you can. So everything's in the proper place, so nothing's really ties up.
Okay, so you're telling us, you see a lot of carpal tunnel, back problems. Any other types of problems?
Yeah, a lot of shoulder problems. Lately, a lot of shoulder problems. I think this is part of the whole syndrome where we're winding, or like this, we're sleeping, or we're working forward. We're sleeping on the shoulders, so the shoulders get rounded, and up here we have a problem with strain conditions, things like that. So shoulders another big one. Headaches. Oftentimes there are cervicogenic headaches, which are really the irritation of the nerves in the neck going into the brain, and it's about the tightening of the muscles
and
here.
And how would
and
you
here.
treat that, something like that?
So that one's an easier one because it's usually involves upper back tightness, upper trap tightness, occiput tightness, which is the base of the cranium in the back, and to loosen all that up so there's more mobility. So it's a matter of kind of restoring the mobility here, and then lifting and adjusting the vertebrae of the neck so they're aligned up so if there is something pinched in there or cut, that would help loosen it up.
Now, what about heat? Do you recommend like a heating pad or a hot compress?
Mm-hmm. Yeah. There's a big, controversy on, well, what's better, cold or hot? Well, if you're going to use hot, you need to use moist heat because moist heat is better for the body instead of the dry heat sort of tendency to dry out the area. And in some cases, that's a good idea. In most musculoskeletal type conditions, you want a moist heat for that.
Have you ever heard of a ginger compress?
Ginger compress? No.
Okay. I'll tell you, our audience, if you're interested, Google ginger compress.
Okay.
But it's basically dipping a towel in hot water with ginger and a cheesecloth. And ginger, it's an ancient Oriental medicine, home remedy, and you put the hot towel on the area where it bothers. So you mentioned a moist heat.
Yeah.
So can you give our audience an example of what you mean by moist heat?
Yeah.
I'm sure a heating pad wouldn't qualify as moist heat.
Well, some do. I have in my office, I have a moist heat pad, which kind of draws moisture from the air and then holds onto it. There's a ceramic element in there.
Oh, I didn't know.
Yeah. So there's the industrial versions, which they're still available, but I use that clinically because it's just easier. You're not messing with a lot of water. Some have pads that you slip in a regular heating pad that holds moisture but doesn't hold moisture all that long.
What does one of these heating pads run? Are they more expensive because of the moisture?
Yeah. The ones that I'd use in office are maybe $100 or somewhere under $100. Or
if somebody's in a lot of pain, they'll spend it.
It's a good investment because you can use it all winter long.
Yeah.
And for a lot of different types of conditions. But the key with any of these therapies is to not have it on the area too long. And that would include cold compresses too, because any more than let's just say 10 or 15 minutes, I like to have people cycle it on. So if they injure their knee, we're going to put moist heat on for maybe 10 minutes, 15 minutes, take it off for about 10 or 15 minutes, on for about 10 or 15 minutes. So you're rotating it. So the tissue doesn't get too much heat. You can over-treat with these things. And same with ice. I have a patient who it felt so good in their back, they left it on for an hour and they had blisters because the tissue froze. So it's that kind of thing. It's over-treatment can cause another problem. The best type of, we're talking about applications of heat and cold, the best type is really sort of a contrast therapy where we're doing both. You're doing moist heat, off, cold, off. So you're rotating these two different modalities to kind of have the best result.
Yeah, I would think the body would kind of tell a person what they needed, whether they need hot or cold?
At the same time, and I get that question, like I said earlier, a lot, but one of the things I do ask is, well, what feels better? What feels better to you? So everybody's different. These are just general kind of guidelines, but there's always exceptions.
Now, do you ever ask your patients about the beds they sleep in or the pillows they use or the position?
Absolutely.
You want to say a few words about that?
Yeah, I had this one attorney who was very busy. She didn't really have a whole lot of time to sleep, and she just restless sleep and a lot of shoulder pain. It took us a while, but first initially treated the shoulder so we had some mobility, got rid of the pain. We talked about, well, what kind of bed do you sleep in? What's your pillow like? How's your sleep? Are you waking up? So those types of things are huge in correcting issues that just don't seem to want to go away. And obviously when you're sleeping in a bed for however long, 2 to 14 hours for teenagers in some case, you want a really good supportive system that can be not put pressure on the
beds,
areas.
they're rated like 5 years, 10 years, 15 years. You got to replace them.
Yeah. I say no matter what they say, it's not going to go more than 10 really. So you should refresh your bed every 10 years or so, and earlier if it's giving you trouble.
What occurs in your first appointment with a patient?
So a detailed history is one of them. So they fill out a typical medical form, all the different medical histories, issues that they've had over the years, medications, supplementation, previous diagnosis, surgeries, traumas,
Do you
anything like that.
have patients provide their medical history before they even step into your office?
Sometimes, yeah. Sometimes if they can get to it and get the form ahead of time, they can fill it out and come on in. But we go through, that's a key part because you want to see what, even an early accident can sometimes later on in life come back to trigger some other issues. So I want to know about that accident you had when you were 23,
Or even age 6 when you fell off the bicycle.
Exactly.
Okay. And your follow-up sessions, are they different than the original session?
Yeah, they're usually less time. Now that I've gotten a good background and I kind of got the topography of the person and really where the areas that are dysfunctional are, I can then go right to those when I'm treating them. So, it's a lot more time is focused on that session into doing the things either manually, nutritionally, or with modalities to try and get to the core of the problem.
Speaking of modalities,
Yes.
why don't you show our audience what we're looking at over here?
Okay, well, as Jay said earlier, I'm certified in light therapies. And light therapies are huge. They've been around for a long, long time. Even in veterinary medicine, they use them a lot, say on horses or dogs, for inflammatory conditions, for pain. So dogs with hip dysplasia, for example, have benefited a lot. So that eliminates the placebo effect from these things. When they started out in veterinary medicine and with dogs don't know, whether or not this is supposed to help them or not. But in 20 years of research, it helps tremendously. It's just a really good tool. And what I use is 2 different types. I use an infrared. Now the infrared technology is all frequency based, and this particular unit runs through a series of frequencies. And now those frequencies affect do different things. So they would maybe go after some, say, inflammation. They would go after pain. Say they would increase circulation. They would increase flexibility.
Frequency, would you use different frequencies at different parts of the body?
Yeah, depending on the conditions, really condition and then a specific point issues. So someone could have even, let's say, intestinal issues. The light will penetrate through the body to a certain degree, a certain depth, that will then sort of excite the cells. Now the whole idea of these therapies, and they've a lot of research again on this, is when the light hits the cell, it stimulates the cell. The cell starts releasing all kinds of good, wonderful chemicals, and one of them is a nitric oxide, which is a very powerful vasodilator. So when you dilate the area, the blood vessels in the area that have a problem, all the other good activities that come through the blood, all the healing processes, the phagocytosis, everything else that's released through the cells to help the body heal, all go to the site. And so it really, the bottom line is it accelerates healing.
Now, let me ask you, do they come in all different shapes and sizes? So, would this be for the back and the spine?
Yeah, I use that one on the back and the spine.
I kind of just imagine, here's the shoulders.
Exactly. So it really kind of goes along the whole back, and I find that it really induces a state of relaxation, because really when you put it over the back and the spine and the back of the cranium, you're hitting this whole central nervous system. So my theory is the patients are always very relaxed after they receive one of these applications, and usually it's at the end of the session. So you've had this session now, and now we place this over for about 15 minutes or so, and then the level of relaxation, of course, that alone, just a stress reduction, lowering of the stress hormones, of the cortisol, it promotes healing too. So there's a component there that isn't directly related to the light, but has a nice side effect.
Now, I'm concerned, let's say, for hygiene. I know you do it, I just don't know how. You wouldn't put this on the back, or would you have to clean this after every use?
Yeah, it has to be right on the skin to have an effect, because anything in between is going to diffract it a little bit, refract it. So put it in like a plastic case, or you can wrap it in clear, say saran wrap or something.
So every patient, it's
gets
clear.
Gets a clear one, yeah. It's a clear covering, because
okay.
we don't have anything transmitted from one to another, but we still want the light to get through, and we still want to be on the skin, so we try,
Now, can you use light therapy on the head as well?
Yes, as a matter of fact, there's been some recent research. They've created these helmets with infrared lights over the cranium for people with Alzheimer's disease.
Wow.
So the effects on the brain, there's been marked improvements with people with these conditions, with repeated applications of the infrared lights to the brain.
I'm laughing because I could see some high school students doing this right before they take their SATs or
it may help.
ACT. Yeah, to help, yeah.
That's another whole market that probably hasn't been explored. But yeah, there is a neurological component, and obviously a brain component that helps neurons, in the brain as well. So that's a huge area that I don't think it's really been.
Harmful side effects to this? Are you aware?
No. In about 20 years of research, there hasn't been really any side effects to any of these light therapies. We're talking including cold laser and including infrared. Now, there's other modalities that works very similarly. Say ultrasound, which works on a sound frequency versus light. They can actually burn the bone or burn the tissue if it's on there too long.
Yeah.
So it's an older technology.
Yeah.
It's effective, but then there's also that risk of actually burning something.
And they make these light technology for joints too, like for knee and ankle, shoulder joints?
Sure, yeah. And you can, for peripheral neuropathy is another one for diabetic patients, so it helps kind of restore the nerve endings in the foot. They're even used over eyes. There's a lot of
to improve the eyesight?
Yeah. And there's a lot of applications that I think are really not even, some are even untapped, We haven't quite gotten to those yet, but basically the safety is there. The only thing I wouldn't say is if you're using a laser, this is a Class 2 FDA device, you don't want to point it in your eye. So this one's okay for ocular treatments, this one not, because it's a matter of focusing of the beam. Even though it doesn't burn, it's not very good for the eyeball.
All right. Well, Dr. Rick, we're out of time. It's been a pleasure and honor to speak with you. For more information about Dr. Rick, Infinity Foundation, or InnerQuest Talk Show, stay tuned to the credits at the end. Until next time, wish you good health, good spirits, and good fortune. Thanks again, Dr. Rick.
Thank you, Jay. Thanks for having me. Appreciate it.
For more information about this show, our guests, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831-8828.